Gulp, but sheep have nice hearts. Exterior anatomy of the heart. Base apex. The apex points to the anatomical left. The human heart is a cone-shaped organ that is about the size of a fist. The base of the heart is the broad superior end. The apex is the inferior, pointed end. It rests on the diaphragm. The apex points to the anatomical left. Apex. Ear-shaped extensions of the atria. Auricles. Ear-shaped extensions of the atria. The auricles are continuous extensions of each atrium. Occasionally this term is applied to the whole atrium. Right. Lieutenant. The auricles wrap around to the anterior side of the heart. A quick and easy way for the students to determine the anterior side of the heart is to look for the directional wrap of the auricles. Anterior. The coronary vessels. The cardiac muscle receives oxygen for metabolism and releases waste products into coronary vessels. Coronary arteries supply the heart muscle with oxygenated blood. Blood returns from the heart wall through coronary veins. Anterior view. The right coronary artery is found in the coronary sulcus. It carries blood to the right atrium and portions of both ventricles. The left coronary artery carries blood to the wall of the left ventricle. Arising from the left coronary artery is the circumflex branch. The great vessels. The large veins and arteries, which transport blood to and from the heart muscle. Remind students that arteries always transport blood away from the heart, whereas veins always transport blood back to the heart. Locating the great vessels. Students may use a probe, hemostats, or gloved finger to locate and probe each of the great vessels. Anterior view. Aortic arch. Aorta. Arising from the left ventricle of the heart is the largest artery of the body, the aorta. Steps. Have students flip heart to anterior side. Point out the part of the aorta that is closest to the heart's base, the aortic root. Remind students that the small arteries that supply blood to the heart muscle, coronaries, come off the aortic root. 3. Point out the curved portion of the aorta, the aortic arch. Remind students that small arteries also come off the aortic arch, which supply blood to the upper chest, neck, arms, and head. Right. Lieutenant. Anterior view. Aortic arch. Lieutenant. Common carotid. Brachiocephalic trunk, innominate artery. Steps. Point out the major branch coming off the right portion of the aortic arch. This is the brachiocephalic trunk, also referred to as the innominate artery. It branches into the right common carotid and the right subclavian artery. 2. The middle vessel coming off the arch is the left common carotid. The carotid arteries supply the neck and head with blood. 3. The opening on the left part of the arch is the left subclavian artery. The subclavian arteries supply blood to the upper limbs. Right. Lieutenant. Aorta, posterior view. Aorta. Lieutenant. Right explanation. After leaving the left atrium, the blood enters the left ventricle where it is pumped into the aorta. The aorta then transports oxygenated blood to the rest of the body. Steps. 1. Locate the large superior vessel that arches towards the posterior aspect of heart. This is the aorta. Remind students that the aorta is the largest artery in the body. Lieutenant. Right. Posterior view. Vena cava. Superior vena cava. Inferior vena cava. Explanation. Low oxygenated blood returns to the right heart via the vena cava to the right atrium. Steps. Turn heart so that the posterior aspect is facing upward. Locate openings leading to the right atrium. Check location by having students insert a probe into each opening to demonstrate how both vessels lead to the right atrium. Students should be able to insert a gloved finger or probe via vena cava into the right auricle and make the ear wiggle. Remind students that the more superior opening is the superior vena cava and the inferior opening is the inferior vena cava. Lieutenant. Right. Posterior view pulmonary artery. Lieutenant pulmonary artery. Explanation. After the blood leaves the right atrium, it flows to the right ventricle which, upon contraction, transports the blood through the pulmonary arteries to the lungs. The pulmonary artery comes off the right ventricle as the pulmonary trunk. The trunk then divides to form the right and left pulmonary arteries. The pulmonary arteries lead to the left and right lungs. Steps. Locate both arteries on the posterior side of heart. The pulmonary arteries are both inferior to the aorta, most superior vessel. Lieutenant. Right. Posterior view pulmonary veins. Explanation. Once in the lungs, the carbon dioxide leaves the blood and oxygen enters. The blood then returns through pulmonary veins and empties into the left atrium of the heart. Steps. Pulmonary veins are on posterior heart. 2. Openings are inferior to the pulmonary arteries. 3. Students should be able to probe and make left auricle wiggle. Right. Lieutenant. Pulmonary veins are inferior to pulmonary arteries. Right. Pulmonary vein. Lieutenant. Pulmonary vein. Interior anatomy of the heart. Dissection begins. Dissect heart on the coronal plane. Steps. Have students hold heart so that apex is downward. 2. Instruct students to turn heart on side and begin dissection on the coronal plane. Open heart on dissection tray. Anterior half. Posterior half. Right. Lieutenant. Right atrium. Lieutenant. Atrium. Right. Lieutenant. Aorta. Septum. Steps. Begin by pointing out the atria. Have students insert probe into vena cava to demonstrate how these vessels empty into the right atrium. Have students probe pulmonary veins to demonstrate how these vessels empty into the left atrium. Point out septal wall. Right. Lieutenant. Width of right ventricular wall. Width of left ventricular wall. Aorta. Width of right ventricular wall. Septum. Width of left ventricular wall. Steps. Point out both ventricles and septal wall. Have students compare width of right ventricular muscle with that of the left ventricular muscle. Ask students to locate and probe the pulmonary valve and pulmonary artery in the right ventricle. Have students locate and probe the aortic valve and aorta in the left ventricle. Lieutenant ventricle. Right ventricle. Tricuspid valve. Septum. Caudate tendonae. Cusp of valve. Papillary muscles. Caudate tendonae. The tricuspid valve is one of two right heart valves. It separates the right atrium from the right ventricle. This valve has three cusps which prevent backflow of blood after it leaves the right atrium. Steps. Have students locate the cusps, caudate tendonae and papillary muscles. Remind the students that the caudate tendonae support the valve and prevent the cusps from flopping back into the right atrium. The papillary muscles anchor the caudate tendonae. Mitral valve. Septum. The mitral valve, also referred to as the tricuspid valve, is one of two left heart valves. It separates the left atrium from the left ventricle. The mitral valve has two cusps. Cusp. Septum. Caudate tendonae. Caudate tendonae. Checkpoints. Exterior heart. You should be able to point out apex and base of heart. Anatomical right and left sides of heart. Anterior and posterior sides of heart. Auricles. Coronary vessels. Checkpoints. Interior heart you should be able to point out. Septum. Atria and ventricles. Tricuspid valve, pulmonary valve, mitral valve, aortic valve, chordae tendineae. Papillary muscles. Begin with vena cava and end with vena cava. Final checkpoint. You should be able to trace pathway of blood through great vessels and heart. Begin with vena cava and end with vena cava.